Gary Roubin, interventional cardiologist.
Awesome. Okay. Tell me a little bit about Dr. Metzger and how you know him.
Dr. Metzger is one of the best interventional cardiologists that I've ever had the privilege to work with. Chris came to visit me approximately 15, 20 years ago to train with me on carotid procedures. And he was incredibly talented, skillful, and receptive learner at that time. And I felt then that Chris would go on to do great things in the world. And in fact, he has proven me correct and has now taken up a position of leadership in terms of interventional cardiology and particularly carotid intervention throughout the world.
Well, it's kind of the same kind of question, I guess, but what do you think are his biggest contributions to cardiovascular medicine and research, both nationally and internationally?
Dr. Metzger, Dr. Metzger has the ability not only to demonstrate great interventional skills when treating complex disease in patients who require very skillful intervention, but he has the unique ability to be able to impart the knowledge and the skills he has through his wonderful personality and his ability to relate to people who are watching him do procedures, and he's able to teach them how to get the best from any procedure that they should attempt.
Good.
Tell us a little bit about yourself.
Tell us about you.
Yeah.
I know Dr. Metzger hates talking about himself too. I knew I'd get that look.
Sorry, but we like hearing about you.
Yeah.
I've spent 50 years from the very early days of interventional cardiology trying to improve patient care through innovation and good research, scientific development of techniques that can improve patient care.
So you were on the front line of basically developing the first ever carotid artery study, correct?
Yes.
How has the field changed? Like, what's the revolution of the technology been like from that to today?
When we began carotid stenting, we didn't understand the need for embolic protection. We didn't understand exactly the best type of stents that we should be using. And then through rigorous investigation and careful observation of our outcomes, many dozens of very good scientific studies, we've demonstrated that carotid stenting is equivalent to or even superior to carotid endarterectomy and other techniques. And we've improved the technology dramatically over the last 20 years. The stents we are now using, the third generation stents, will be able to outperform anything that we've been able to do with carotid bifurcation disease up to this time.